This is Dr. David Tam, President and CEO of Beebe Healthcare, and I'm in my office, and I'm just going to take my mask off so you can hear me. We do this because it's so important for everybody to recognize just how important this thing is for us several weeks. Today is the 22nd of December, 3 days before Christmas. Time now is 6:01 p.m. and we are holding a special edition of this town hall today because we feel that so much is going on so fast, so quickly that we wanted to get you this information about what's going on with COVID, with Omicron, with monoclonal antibodies, with Delta, and what's going on here at the hospital in your local nonprofit independent community health system. As always, I'm here with Dr. Bill Chasanov. We're going to try a little something different because we're both on Blue Jeans and also on Facebook Live. So we're trying out something different to make sure that as many people as possible can see what we're doing. What that means is when I hand it off to Dr. Chasanov, I'm going to put my mask back on and vacate my chair, and then Dr. Chasanov will step in, sit down, take his mask off because it's so important once again, that we do everything possible to combat this COVID pandemic. We're holding this because, to be perfectly frank, the cases of COVID-19 are growing here in Sussex County, as well as in Delaware and across the country and the world. You'll hear about this from Dr. Chasanov. You know, here at Beebe Healthcare, we've doubled the number of COVID patients in the hospital. He'll talk more about that. That plus the fact that we have more people living here in Sussex County, which is a great thing, but here for the holidays and getting sick, as well as the fact that, as you know, there is a national nursing and personnel shortage, has got to the point where we at Beebe Healthcare are taking extraordinary measures to make sure that we continue to provide safe, high-quality care for everybody who comes to us. And I want to be very deliberate about that because you might have to wait a little longer in an emergency room, or you might have to hold off on that non-emergent procedure or surgery. But all that is because we at Beebe Healthcare are focused on ensuring that you get the highest quality, safe care. And so please know that we're all open. We continue to do the work that we need to do, but we are taking measures to make sure that your care is safe, that your care is of high quality, because that's our commitment as your local nonprofit independent community health system. Remember, there are several things that you can continue to do to make sure that you help us help you. One, continue to wear your mask, continue to watch your distance, and get vaccinated. And by the way, that's just not the COVID vaccine, but the flu vaccine. We'll talk a little bit later about how you can get that access through Beebe Healthcare or any other places here in the county. And remember, we're just focused on making sure that the county is taken care of. We'll talk more about the ways you get that service at our 2 COVID centers here in Sussex County. And you'll also need to hear a little bit from Bill about what's going on with Omicron and what that means with respect to the efficacy of the vaccine. And we have the most up-to-date information about that so you can make the best decisions possible about how to get through and enjoy your Christmas and holiday season. We all need to work together to decrease this trend, and we can still do it. We did it before when we didn't have a vaccine or monoclonal antibodies. We did it by making sure we took care of each other, wore a mask, watched our distances, and just made sure we stayed healthy. So I hope that you get as much as you can out of this town hall meeting tonight. And I'll be back. But right now, I do want to hand it over to Dr. Bill Chasanov, who is our COVID-19 medical director, infectious disease specialist, and also the vice president for population health. And because he's coming in the room, because we're using one camera, I'm putting my mask back on because it's so important for all of us, even though he and I are both vaccinated, that we do everything possible to keep each other safe and protect ourselves and our families. So don't go away. Here comes Dr. Chasanov.
Thank you, Dr. Tam. Thank everyone for waiting for that, for those 30 seconds while we switch places. Appreciate that. A lot of what I'm going to talk about, Dr. Tam has graciously kind of outlined for us. Extremely important for everyone who is on this Blue Jeans meeting, but also for you to spread this message to your friends and your family. We continue to see an increased number, not just in our county and community, but throughout the state of Delaware and throughout the country in COVID-19 cases. The healthcare systems in our state, not only Beebe Healthcare, are seeing high capacity, meaning high numbers of patients being hospitalized. What is making that worse is the number of COVID patients that are requiring hospitalization are also on the rise. Hospitalizations in the state of Delaware for COVID more than doubled since what we were seeing right before Thanksgiving. These are our community members, these are our family, these are our friends, these are our neighbors. They are being hospitalized, and some of them, unfortunately, are ending up in the ICU and unfortunately not doing well. This is throughout the state of Delaware and throughout the country. The majority of the patients that we are seeing that are requiring hospitalization are unvaccinated individuals. And I say that to everyone here because one of the most important things that someone can do to prevent themselves from being hospitalized, ending up severely ill and in the ICU, is to be vaccinated for COVID-19. As usual, I want to provide some numbers. I think numbers are extremely important. In the United States, let me pause. What I will say is that all these numbers are public. This is not something that I only have access to or Dr. Tam has access to. These are numbers that everyone has access to. Per the Johns Hopkins coronavirus website that was started shortly after the pandemic started, in the United States, they report about 51.5 million confirmed cases of COVID-19. Out of those 51.5 million confirmed cases, citizens from the United States, we have had approximately 812,000 deaths because of COVID-19. In the state of Delaware, we have had 167,493 positive COVID-19 cases, and unfortunately, we have lost 2,249 Delawareans to COVID-19. In the state of Delaware, the current hospitalizations reported from the state of Delaware that collects this data on a daily basis, 392 patients hospitalized with COVID-19 as of this morning. Out of those 392, 51 of those are receiving ICU level of care. To put that into comparison, on November 25th, approximately 1 month ago, there was about 160 patients hospitalized because of COVID-19. Sussex County is seeing the same as the rest of the state of Delaware with increased COVID-19 positive cases and hospitalizations. What I do want to talk about is this Omicron variant that many of you have heard about. For the last few months, we've been talking primarily about the Delta variant. What a variant is when the virus itself changes a little bit, so that way it's a little bit different than the original virus that started. So when we talk about a Delta variant, the Delta variant is different than the original strain that we saw back in December, January, February around the world in 2019. The Delta variant changed a little bit, and we now are seeing the Omicron variant, which has changed in a different way than the original strain that we saw back in December of 2019. What's interesting about this variant is that even just a few weeks ago, we had not had any detectable cases in the United States. As of today, not just in Delaware, and I will say throughout the entire United States, 70% plus of all the cases, the new cases of COVID-19 that are identified are due to this Omicron variant. We're still learning a lot about the Omicron variant, but preliminary data suggests that the Omicron variant spreads as fast as the Delta variant, which we knew that the Delta variant spread faster than the original strain we saw back in the early 2020 and late 2019. Delaware has reported cases of the Omicron variant. A week ago, we did not. We have now detected in the past week several cases of the Omicron variant. Another piece to this puzzle as we go into the winter months, as Dr. Tam alluded to, is the flu. Last year, if you remember, many people were not eligible for the Pfizer vaccine when it came out in December of 2020. If you remember, there was a tier system of who was eligible for that vaccine. So many people through the winter months correctly wore masks, they washed their hands frequently, and they watched their distance, which meant that our flu season last year was very, very little. We had less than 100 cases of the flu reported out the state of Delaware for the entire winter. As of 12/17, with the last report that has come out, we are already at 99 cases of the flu for this season. So we've already almost tripled the number of flu cases that are being reported, and it is only the middle of December. As we move further into the winter months, we are expecting to have a significant flu season, definitely a flu season that is significantly different than what we saw last year. So what can you do to prevent yourself from becoming severely ill from COVID-19? Well, the first and foremost thing is if you are eligible to receive the vaccine, and I'm referring to one of the COVID-19 vaccines, please consider receiving it. If you have received a full series of the Johnson & Johnson, the Moderna, or the Pfizer vaccine, please consider getting a booster because almost everyone is eligible for that. So if you've received any of those vaccines and you're considered fully vaccinated, please consider receiving a booster. Also, please keep in mind that we are expecting to have a flu season this year, where we did not have a significant flu season last year. What we don't want to happen is for people to be co-infected with the flu and COVID-19 at the same time. That is not good. So we are asking you, if you're eligible to receive the flu vaccine, to please also consider receiving the flu vaccine. If you are unfortunate to be diagnosed and infected with COVID-19, what I need you to do is reach out to your primary care provider to discuss options that are available to you. Right now, as Dr. Tam had alluded to, we have something called monoclonal antibodies that Beebe Healthcare is busy delivering on a daily basis to as many community members as we can. Very soon, we will have FDA authorization on pills that we will decide how can best be used in our community from becoming severely ill with COVID-19. Your primary care provider is able to guide you through that process to see what you are eligible for. If by chance that you do not have a primary care provider and you are seeking help, if you need emergency help, please go to the emergency department to seek that. But if you do not need emergency help, please reach out to us through our access line at 302-645-3200. We operate that line Monday through Friday from 8 a.m. to 4:30 p.m. We will work very hard to get you seen by a primary care physician or to make sure that if you are potentially eligible for monoclonal antibody, we can help get that for you. I want to say that Beebe Healthcare is here to serve you. I will tell you that everyone is working extremely hard to make sure that you have the best care that you can possibly get and to get you everything that you need, but we need your help. We need you to get your COVID-19 vaccines if you're eligible for them. We need you to get your flu vaccines if you are able to do that. If you are unable to get your COVID-19 vaccine for some reason, as the holiday seasons come up, please remember the 3 W's. Please wear a mask. Please wash your hands and please watch your distance. We all want to gather with family and friends we have not seen for months, sometimes over a year. But these are the things that will keep you safe, family, your friends, your loved ones, and your neighbors safe as we expect to go into a significant time of higher COVID-19 numbers, hospitalizations. I want to wish you all a happy holiday. Please be safe. We will continue to update you as we can with more information. And it is my pleasure to turn this back over to Dr. Tam. Thank you all very much.
Thank you, Bill. So I'm just here to wrap up and reiterate a few things, and also do something that as a CEO, as a doctor, it's really sometimes hard to do, which is ask for help. I need your help. We need your help. So you heard from Dr. Chasanov that Omicron is here. You heard from him that Delta is still here. You heard from him that the numbers are still going up. When I look at the numbers of patients in the hospital who had COVID-19 a year ago, we're at the same place. The same number of patients that we have with COVID-19 in the hospital today is almost identical to what we had in 2020. The difference is that we also have more patients with other conditions in the hospital: heart attacks, strokes, other medical conditions, flu. There weren't a lot of flu, as Dr. Chasanov said, but there is now, because last year everybody was so religious about wearing the mask, and we know that that's how the flu virus is spread. So we're in a place where we have the same numbers, and if you then look to see where Beebe Healthcare was in January, in the middle of January, we had about 20 to 25 more COVID-19 patients. And so if you think about where I and the rest of us here at Beebe Healthcare worry about, we think about what the number could be for us in the hospital taking care of patients in January of 2022. And I will tell you that, as a doctor, you never think about, oh my God, is there anything we can do? As a CEO, you always want to think about the options that we have and how we can pull this out. As a naval officer, you always think about how we will persevere and overcome. But we're at a point now where we recognize that the number of patients, and by the way, don't forget that there's a national nursing shortage because people who have worked in healthcare for so many years are now tired and getting out of the industry. All those put together mean that we need to work together, and I need to ask you, the community, to do everything that you can to get that number down. We know the vaccine works. We know that it makes a difference, especially here in the United States. Get your vaccine. We know that the flu vaccine works. Get your flu vaccine. Dr. Chasanov would have told you that you can get both of those at the same time, and it's not going to create any significant reaction because you took them together. Wear your mask. Wear your mask. Please wear your mask. Wash your hands. And do everything you can to be socially distant as much as possible, recognizing that it's so hard. It doesn't mean that you have to stay in your room or your house all by yourself. However, it does mean being a little more cognizant of what's going on around you, asking your friends who are coming or asking your family, are you vaccinated? Have you had symptoms? And if you have, can you be respectful of the fact that we just need to continue to try and avoid getting sick? Dr. Chasanov also talked about how we really would love you to make sure that you go see your primary care physician. I know it's the holidays. A lot of people are taking time off. We'll do everything here at Beebe Healthcare to keep our walk-in clinics open, to keep our primary care clinics open, to make sure that you have an option before going to our emergency room. And then the last part is, if you do need to come to the emergency room, please know that we are open. We will take care of you, but we want to provide safe, quality care. And that means triaging to make sure that we take care of the people who are most critical first before we take care of other people. It's not rationing. It's just a matter of knowing, what we have to do first before we move on to other people. And so please know that might mean that you might have to wait. And by the way, this is not something that's going on just at Beebe Healthcare. It is going on across the state, across the country. Wherever you go, it is the same situation, and may, in some situations, even worse. Please take care of yourself. I know that all of us want to have a good holiday season. But please know that our people here at Beebe Healthcare have been on the front lines for the last almost 2 years. I got here in March of 2020, and here we are in almost January of 2022, and we're still dealing with this. I am proud of the people who work at Beebe Healthcare. I am honored to be with them, but I will tell you, as I walk around the hospital and our clinics, people are tired. People are working very hard to serve this community. It's not something that they're going to tell you about, because that's just not the way they operate. They will come and do their work every single day. And I am asking you to please do everything possible to take care of yourself, to make sure you don't need to use our services. And that if you do, please, please, please be kind, be gentle to our team who are working every day, coming in the morning, coming in at night to take care of our community. On behalf of everybody here at Beebe Healthcare, I want to thank you for continuing to support your local nonprofit independent community health system. We are here for you. We serve Sussex County. I hope that you have a healthy and safe holiday season. And I just want to wish every single one of you watching and maybe seeing this on video, Merry Christmas, Happy Hanukkah, Happy Kwanzaa, Happy Holidays, and we look forward to serving you and being part of the community with you 2022. On behalf of everybody at Beebe Healthcare, have a great day.